Hi. This is a case of large macular hole in a moderate myope patient. She is 57 years old and complained of reduced vision and seeing crooked line, or we call it metamorphopsia. Size of the hole is large. The hole form factor render unfavorable closure. We start with doing core vitrectomy and slowly move around to look for any suspicious weak point on the retina before inducing the PVD. She was found to have multiple retinal tuft, which was suspicious, and a cluster of retinal tears temporally. This is a Fakich eye. Instead of using triamcinolone, we will be using the ILM twin dye to stain the vitreous temporary. Now the edge of the posterior hyaloid around the disc is much more apparent. And obviously she had type 3 hole with incomplete PVD. We induced the PVD while keeping an eye on the peripheral retina. Gently lift up the posterior hyaloid off. Further peripheral vitreous trimming was done around the tear, as further induction causes enlargement of the tear. We would like to limit the tear without causing retinal detachment. Now we will be doing the peeling. Again we use the ILM twin. The dye sink down nicely in fluid. Once we identify the membrane, we utilize the pinch and pull technique, gently lifting it up to release the ILM away from the retina. This helped to avoid accidentally pinch onto the retinal surface. Once loosely released, we start the peeling in circumferential manner. Restain is occasionally needed to be able to visualize the edge of membrane clearly. Bringing the ILM flap over the hole and gently tuck it into the hole. I love to use 27 gauge ILM forceps, even I was using the larger size trocar. The 27 gauge forceps seems to be more gentle and give better control for such cases. Because I always use the valve trocar, there is no issue of fluid leak from the port, even I was using a smaller instrument. We proceed with lasering all the tears. And followed by air-gas exchange. At 1 month, her vision and METAMORPHOPSIA improved and scans showed a close hole. Although there was discontinuity of the IS and OS junction. Symptoms recover almost 80% as described by the patient. Thank you.